Hello, everybody. How you doing out there today? It's your guy, Mr. Talk 718 with Talk Like the podcast. And today, my conversation is going to be about fibroids, one of the 8 health conditions that disproportionately affect black women. Okay? We all know, if we don't know, we will find out today what fibroids are. Fibroids. Black women are 3 times more likely than women of other races to get uterine fibroids, noncancerous tumor in the walls of the uterus. According to the Department of Health and Human Service Office on Women's Health, fibroids are largely genetic and there is no known way to prevent them. Fibroids are abnormal growth that develop in or on a woman's uterus. Sometimes these tumors become quite large and cause severe abdominal pain and heavy period. In other cases, they causes no sign or symptoms at all. The growth are typically benign or non-cancerous. The cause of fibroids are unknown. And we have 4 different names that I will not pronounce right, but if you can see them, they're there. I'm not really gonna try to pronounce them. Maybe I should. Myomas, uterine myomas, fibromas, and leiomyomas. Did I say that right, ladies? If I did, please let me know in the comments down below. All right. According to the Office of Women's Health, up to 80% of women have them by the age of 50. However, most women don't have any symptoms and may never know they had fibroids. And this is from womenshealth.gov. What are the different types of fibroids, you ask? The type of fibroids a woman develops depends on its location in or on the uterus. Intramural fibroids are the most common type of fibroids. These fibroids appear within the muscular wall of the uterus. Intramural fibroids may grow large and can stretch your womb. Okay? As you can see, I have the arrows pointing to where it says intramural fibroid, and it's just showing you exactly what area it's in. If you never seen what it looked like, this is kind of a depiction of what it would look like inside of the woman's uterus. Subserosal fibroids form on the outside of the uterus, which is called the serosa. They may grow large enough to make your womb appear bigger on one side. So, ladies, think about it like this. If you see someone and they have a large lump on their belly, right? And they're not pregnant and they're not really overweight, 9 times out of 10, I'll say 7 times out of 10, it's probably going to be a subserosal fibroid because it makes the belly stretch, right? So the womb is the stomach. The stomach is your womb. To the brothers that's out here that's trying to get on page. All right. Then you got the pedunculated fibroid. Subserosal tumors can develop a stem, a slender base that supports the tumor. When they do, they're known as pedunculated fibroids. As you can see, if you look at the picture of the uterus, at the very top, there's a, like, I want to say a beet shape shape at the top. That would be the pedunculated fibroid, and that looks serious. The submucosal fibroid, these type of tumors develop in the middle muscular layer of the myometrium of your uterus. Submucosal tumors aren't as common as the other types. So it's very rare that a woman would get a submucosal fibroid because, like they said, it's very, very, very rare. It's not a common thing to get that. But I'm pretty sure some of you ladies have had it, and I'm praying for y'all. What causes fibroids? It's unclear why fibroids are developed in the body, but several factors may influence their formation. Estrogen and progesterone are the hormones produced by the ovaries. They cause the uterine lining to regenerate during each menstrual cycle and may stimulate the growth of fibroids. So let me give you an example of like stimulated growth, regenerating. Think about a man with a keloid or a woman with a keloid, right? Let's say they every time they get a haircut, or let's say every time they get a scratch, or if they put earrings in their ear, what happens? They get this little bubble on their skin, right? So the earring punctured the skin, and while the skin is trying to heal up as fast as it can, it's becoming bigger and bigger because it's continuously trying to heal. That's what a keloid is. So when you think of the uterine lining to regenerate during the menstrual cycle, it's growing faster and faster and faster. Well, that's what a keloid is. Keloid and a fibroids, they're pretty much the same thing, right? It causes it causes pain and discomfort to the person who has it. Let's move on to the next slide. Family history may run in a family. If your mom, your sister, your grandma, your auntie, if they have it, you know, that's a history. You may develop it as well. Pregnancy also increases the production of estrogen and progesterone in the body. Fibroids may develop and grow rapidly while you're pregnant. So there's another way they think fibroids, grow. Who is at risk for fibroids? Women are greater. Women are at a greater risk for developing fibroids if they have one or more of the following risk factors. Now, I'm going to skip 1, 2, and 3 and go straight to 4. 4 is African Americans. Bullet point 4 is African American. African American women who they're at a higher risk. You don't see any other group here. This is why it's a part of this series. It's disproportionate in the black community. This is a health condition that there's no real way to cure it. There's no real way to understand it, not yet anyway. Again, if you trust the science will definitely get you to the point, but the question is when. If they have vaccinations and things that can help people stay alive with HIV, I'm pretty sure they can figure out with fibroids where they come from and why it's largely in the black community. Anyway, we already touched on some of the information: pregnancy, a family history, 30 or older. So if you're 30 or older, ladies, please go out to your gynecologist and get checked out to see if you are a woman that has fibroids. And also, they say a high body weight. So if you're overweight, please, let's do the right thing to get ourselves together. Let's go on a walk. Let's do it 3 times a week. I'll walk with you. What are the symptoms of fibroids? Okay. Your symptoms will depend on the number of tumors you have as well as their location and size. For instance, submucosal fibroids may cause heavy menstrual bleeding and trouble conceiving. So that's called being blocked. I know a lot of ladies that they try to have babies and they just want babies. And with the cost of healthcare and things like that, they're unable to actually go to a fertility doctor and get, what they need to get to have a baby. So that's something that's very serious, and it affects a lot of women. They don't understand why they can't have babies. It's because submucosal fibroids. Not all the time, but a lot of the times. If your tumor is very small or you're going through menopause, you may not even have to worry about the symptoms, because when you're dealing with fibroids and you're dealing with menopause, your estrogen is going down. So when you're dealing with that, it's a less of an issue. You know what I mean? Hormones, they stimulate the growth of fibroids. So if you ladies are going through menopause and you haven't had any symptoms and you're doing good and there's no pain or no heavy bleeding, and you're at the first stages of menopause, don't worry about it. You should be good. The fibroids will shrink if you got any. Symptoms of fibroids may include heavy bleeding between or during your period. That includes blood clots, pain in the pelvis or lower back, increased menstrual cramping, increased urination, pain during intercourse, menstruation that lasts longer than usual. I think they say a menstrual should last anywhere between 3 and 7 days. So if you have anything, if you're a 3-dayer and you get 7 days, 8 days, 9 days, you need to go see a doctor. And if you're a woman that has 7 days and it goes longer than 10 or 11, yes, please go see your doctor. If you have pressure or fullness in your lower abdomen. So again, remember I was talking about some women, they have these fibroids, and the fibroids, they can grow so large it makes you feel like you're full. It can make you look like you're pregnant. So if you have any fullness in your lower abdomen or pressure, that can be a serious sign to let you know that you might have fibroids or swelling or enlargement of the abdomen. So these two, they kind of coincide with each other. Now, how are fibroids diagnosed? Well, for a proper diagnosis, you'll need to see a gynecologist and get a pelvic exam. I said pelvis, but pelvic exam. The exam is used to check the condition, size, shape of your uterus. You may also need other tests, which includes an ultrasound. And what an ultrasound is a high frequency sound wave. It produces images on a screen. This will allow doctors to see internal structures and any fibroids that might be there. They use a transvaginal ultrasound in which the ultrasound wand is inserted into the vagina, and that provides clearer pictures since it's closer to the uterus during these procedures. So if you look at the pictures here that I have, you see the machine I don't know which way y'all looking. It's to the left, but my camera is funny. So if it's on your left, that's the ultrasound, and to the right, there's a depiction of a vaginal transducer being inserted into a woman's vagina to take pictures of her uterus. So if you've never had to experience that, that's what it looked like. I want you to be prepared if you ever had to go through these issues. A pelvic MRI. A pelvic MRI is an in-depth imaging test. It produces pictures of your uterus, ovaries, and your pelvic organs. How are fibroids treated? Your doctor would develop a treatment. The treatment would be based on your age, your size of the fibroid, and your overall health. You may receive a combination of treatments. Home remedies and natural treatments. Certain home remedies and natural treatments can have positive effects on fibroids, including acupuncture, yoga, massage, Gu Zhi Fu Ling Tang, GFLT, a traditional Chinese medicine formula. Applying heat for cramps. Avoid heat if you experience heavy bleeding. So ladies, if you have heavy, hard bleeding, do not use heat. But if you have strictly cramps, use the heat. All right? So I want you to just remember that. I want y'all to remember that. Dietary changes can help as well. Avoid meat and high-calorie foods. Instead, opt for food high in flavonoids, green vegetable, green tea, cold water fish such as tuna and salmon. Manage your stress levels and lose weight if you're overweight. You can benefit from that. Medicines. Medications to regulate your hormone levels may be prescribed to shrink fibroids. So a lot of the times, ladies, in our community, in Black communities, we tend to not really care for medicine, right? We don't like doctors. And it's not because we don't want the help. It's because we were taught that, you only go to the hospital if you're dying. You know what I mean? If you're in pain, go and see your doctor. Okay, you got the GnRH and you got Lupron. They will cause your estrogen and progesterone levels to drop. They will eventually stop menstruation and shrink fibroids. So if you're ready to stop having a period, these medications will do that for you. Okay, but I don't know what they'll do if you're trying to have a baby, because you need to have a menstruation in order to have your egg. Y'all know the science, right? Anyway, GnRH also helps shrink fibroids. They work by stopping your body from producing follicle stimulating hormone, FSH, and luteinizing hormone, LH. Examples include ganirellic, citrullic, acetate, or acetate, yeah, whatever, and elogalic, which is presented in an oral drug. So two of them are injectable. You use a syringe, and one is by mouth. You have other options that can help control bleeding and pain, but won't shrink or eliminate the fibroids. And you have an IUD that releases the hormone progestin. And then you have OTCs, anti-inflammatory pain relievers, such as ibuprofen, which is Advil. We all know that. And birth control pills. So just remember, these are some of the other options you have when you're going through serious fibroid issues. I know this is a little graphic, but this is what it looks like. These are pictures of actual surgeries and before and after, like when you cut and when you suture. So the top is the fibroid uterus. This is then you got the laparoscopic myomastectomy, and then you got the laparoscopic yeah. And so they're all three the same. So the first one is a picture. The second one, they're about to cut. The third one, they cut it open and now they're looking at it. The fourth one, this is after the I don't even know. The fourth one is a myoma red, and the last one is when it's completely sutured. So you see them in 6 steps from the beginning to the end. That's what it looked like. So it says surgery to remove very large or multiple growths may be performed. This is known as a myomectomy and abdominal myomectomy. It's mectomy. I'm gonna go with mectomy. Myomectomy. And it involves making a large incision in the abdomen to access the uterus and remove the fibroids. The surgery can also be performed laparoscopically, which is using what they're using is like they're not using their hands. They're using something that could take a picture, and they're doing it through like a computer screen, right? Using a few small incisions into which surgical tools and a camera is inserted. Fibroids might grow back after surgery. If your condition worsens, or if no other treatment works, your physician may perform a hysterectomy. However, this means that you won't be able to bear children in the future. Non-invasive or minimally invasive procedures. Well, we all know technology is always getting better. So with that being said, newer and completely non-invasive surgical procedures is forced ultrasound surgery, FUS. You lie down inside a special MRI machine that allows doctors to visualize the inside of your uterus. High energy, high frequency sound waves are detected at the fibroid to destroy them. So we have endometrial ablation. It involves inserting a special instrument into the uterus to destroy the uterine lining using heat, electronic current, hot water, or extreme cold. Another non-surgical option is uterine artery embolization. In this procedure, small particles are injected into the uterus in order to cut off the fibroid blood supply. That's serious. What can be expected in the long term? Well, your prognosis will depend on the size and location of your fibroid. Fibroids may not need treatment if they're small or don't produce symptoms. So if you're at a doctor, gynecologist, and they say that you have small fibroids, and then they tell you that you have to have surgery to remove them, understand that you don't if they're not causing any symptoms. Sometimes we jump the gun. Sometimes we listen to the doctors. And I mean, not to say the doctors are wrong, but you got to remember you're dealing with the human element, right? So a lot of this is about money. So if you have fibroids and you go to the gynecologist and you're doing your monthly test or your 6-month test, and you're doing everything, get a pap smear and all of that, and they say to you, oh, we see fibroids, we have to take them out, but you don't have any of the issues that I spoke about today, just know that doctor is trying to just, get your health insurance money or your cash or whatever you use to pay for your doctor's bills. If you're pregnant and have fibroids or become pregnant and have fibroids, your doctor will carefully monitor your condition. In most cases, fibroids don't cause problems during pregnancy. Speak with your doctor if you expect to become pregnant and have fibroids. And with that, my ladies and gents, this is part 3 of, if y'all can say it with me, let me hear y'all say it with me. 1, 2, 3. 8 health conditions that disproportionately affect Black women. This is part 3, fibroids. I want to say thank you to everybody that's listening, watching. I gladly, greatly appreciate all your support. If you've gotten through the entire video, please feel free to subscribe and add. Every click counts. So I just want to say, from the Talk Life Studios in Jacksonville, Florida, to the world, I greatly appreciate you guys. One love. Love is love. Black Equality Movement. And peace.